what causes treatment to fail? So unfortunately, not everybody with plantar fasciitis will necessarily get full pain relief or recover from the problem. However, this is the minority of people. But the most common reason why treatment might not be successful can be misdiagnosis. So this may involve an incorrect self-diagnosis from a patient, or it might be a misdiagnosis provided by a clinician. However, misdiagnosis is not the only reason why treatment can fail. In my experience, treatment does fail if the underlying cause of the problem has not been sufficiently addressed. So, if you've got excessively tight calf muscles, and this is a leading risk factor as to why you've developed plantar fasciitis in the first place, and you've been provided with a treatment plan which doesn't address this problem, let's say you've been given an orthotic, which is an arch support, but your foot doesn't really need extra arch support, this treatment option is then therefore not right for you. So it's not been tailored to your individual needs. And this is why you can't treat everybody the same with plantar fasciitis. We can't just throw insoles at people and expect everybody to get better with that approach. Another reason is that you may have been provided with a treatment which is perfectly appropriate and absolutely necessary. So let's say, again, going back to our calf muscle example, you've got very tight calf muscles and you've been provided with a stretching exercise program by your clinician. Well, that's all well and good, but it does involve you being very much on board with the treatment programs. You've got to be invested in it, and you're just as responsible for helping the problem and getting over it as much as a clinician is. So if you're not doing your stretching exercises as you've been advised to do, then we're not going to sufficiently address the underlying cause, and this is a really big roadblock as to why some people don't get better. So it's really, really important that you follow the advice that you've been given. Another reason is that for some people, the condition can become very degenerative and very chronic. Chronic refers to time frame, so it doesn't necessarily refer to severity of the problem. So in the medical profession, we tend to use the word chronic for a soft tissue condition like plantar fasciitis, which has been ongoing for more than 3 months. We know that the longer you've suffered with the problem, the more challenging it is to treat it. And that's because as more time goes by, it's more difficult to address the underlying causative factors, and it's more difficult for the tissue to heal. Fortunately, there are advanced treatment options which can help with chronic or really stubborn cases of plantar fasciitis, and extracorporeal shockwave therapy is a very, very common and popular treatment option which you might have heard of. So luckily, we do have options in place to help with particularly stubborn cases of plantar fasciitis. However, there isn't any single treatment which is 100% successful. So in summary, the main reason why people don't make a full recovery from plantar fasciitis is usually down to the treatment plan not addressing the underlying causes of the problem in the first place. And this is something I particularly focus on with all of my treatment plans. So I make them very bespoke and individualized to the person in front of me, and I find this is what yields best results. If you found this video useful, please feel free to share, and if you'd like to receive further information and check out some free educational resources, go to the website www.theheelpainexpert.com. Thanks for watching.